Good morning, good afternoon, good evening. Whatever time it is when you watch this, I'm delighted to connect. I'm Evonne Miller. I'm Professor of Design Psychology and Director of the QUT Design Lab. And I currently have a secondment with Queensland Health, where I'm the Research Chair in Healthcare Design. And today I just wanted to talk through a few ideas about sustainability in our healthcare system and how we might make sustainability a greater priority than it currently is. For the last couple of years, I've been the co-lead of HEAL, the Healthcare Excellence Accelerator, and that's put designers, design thinking and design doing into hospitals across the state of Queensland. HEAL's underpinned by the belief that designers, in collaboration with clinicians and consumers, can have a significant difference on all kinds of problems, whether that is, increasing the uptake of technology, redesigning the built environment, or helping us come together collaboratively to co-design, co-produce, co-create, co-future, co-innovate, and co-implement all kinds of design-led innovations around change. And I guess it's fair to say that I'm a great believer in the notion of collaboration, because it's where collaboration that innovation occurs. And I think that's the number one piece of advice I would have to you as you embark on this project, as you actually talk to as many people as possible, collaborate with each other, and think about what are the ideas that we can have that can make a greater change happen. One of the tools you might want to consider using is something that my colleague and I, Deb Cushing, talked about in our most recent book, Redesigning the Unremarkable. In that, we look at 10 unremarkable features and elements of the built environment, from rubbish bins to streets to parking lots and bikeways, and we talk about how we might redesign those to be more playable, to be, of course, sustainable, and to be salutogenic, that is, health promoting. And one of the ways we do that is we use an approach we call theory storming. And in that, we argue that you should, if you want to redesign, say, for example, this handbag to be, different, you could put on a different theory lens and redesign it through the lens of playable design, sustainable design, biophilic design, and affordance theory. You pick the frame that you want and you redesign, you think creatively about the problem. And this builds on Edward de Bono's 6 thinking hats metaphor, which is that you put on a different thinking hat, like to be, critical, or to be creative, or to be, pragmatic, and you reimagine it through that lens. And so as you approach these challenges that you're working on, I would argue or suggest that you should think about potentially using a theory storming approach. And so put on the hat of, yes, of course, sustainable design, but then think, okay, how might we redesign this through the lens of playable design? Or if I was a nurse or a patient, what would I do or think differently? And the whole idea is to step out of yourself and to think differently about how you might solve a problem. And so I just wanted to give you that kind of tool to help. And of course, when it comes to sustainability, often people use a framework called triple bottom line, or the TBL approach, and it argues that organisations have a moral obligation to do more than simply make money, and they need to and are obligated to actually look after our planet and look after the environment that we have. So John Elkerton, many decades ago now, argued for the triple bottom line approach and argued that we need to consider, yes, P for profit, but also P for people and P for the planet. And we need to think of those things and take account of them. And more recent articulations of this have argued that the core focus for organisations and in this triple bottom line approach needs to be the P for planet or environment, needs to be the core first circle, because without nature, we have nothing. And as designers and clinicians, it's our obligation to rise to the challenge of climate change and be part of the solution, not the problem. There's this great quote by Thackeray where he talks about, are designers guilty of killing the planet? 80% of the environmental impact of products and buildings that surround us are determined at the design stage. And so we need to actually become part of the solution and to think in different ways about the choices that we're making when we design products and when we interact with them as well. And so we can think about systems thinking, product lifecycle, and circular design to move away from that take, make, dump mentality, that's the linear economy, to move towards a recycling economy where materials, yes, they're are recycled as much as possible, although many end up in landfills. And so the most recent conversation is about thinking about a circular economy with a closed loop. And you can see this in this diagram here, which is from a book Deborah and I wrote called Creating Great Places, where we talk about evidence-based urban design for health and well-being, and we talk about how can we transition towards a closed loop economy where nothing is trashed. And that's, I guess, the challenge that you have for you. So how can hospitals be green? Well, buildings can do more. That's the first thing. They can be designed to be sustainable in their design and operation, and occupants can change behaviour. So the green building movement is driven by this notion that the buildings where we live and where we work can do much more than they can restore more than instead of consume. So they can inspire instead of constrain. They can actually give back. They can be restorative, and they can be designed to produce more energy than they consume. And how might you do that? There's a number of different ways and systems out there. So perhaps one of the most well-known, the Green Building Council of Australia, is a Green Star performance audit, one of the first hospitals to receive a 5-star Green Star performance rating is STARS here in Brisbane, the Surgical Treatment and Rehabilitation Service, and it was being praised for efficient water systems and processes, for sustainable water management, and for architectural design that lends itself to airflow and peak thermal performance. So thinking about all those elements of the built environment, energy, waste, and how we might design them to be more sustainable. When you're in Singapore, you might want to take a moment to visit QUT Hospital, which is said to be the world's most biophilic hospital, designed with nature in mind. And it's also connected to the Living Building Challenge and its Petals framework. So if you're interested in that kind of thing, please look that up. But the whole idea here is it's connected to nature through sights and sounds and smells. There's a diversity of plants and birds and butterflies. You can hear the water, you can see the greenery, and instead of being stressed when you arrive at a hospital space, you're actually calmed by the environment. And I've written an article about how we might redesign aged care with a biophilic lens. You can find some more examples there. And if you want to look elsewhere, just look online for the Global Green and Healthy Hospitals Network, which is a global movement about how we might actually reduce the environmental footprint of healthcare facilities. And it looks at many things, from transportation to food to the pharmaceuticals and chemicals, waste and water. But alongside designing hospitals to be more green, when we think about their design and retrofit, we can actually also encourage occupants to change their behaviour. And here's an example. It's a few years old now. It's from the UK, and they developed a behaviour change intervention. So they put some signs and some information, communication out there, encouraging employees to do what they call TLC actions. Turn off machines, the T. L, lights out when not needed, and C, closed door where possible. And this had a significant impact on reducing energy consumption, and it also increased work efficiency because it actually also increased the quiet times in hospitals, so it increased patients' quality of sleep. So there's an example of initiative that actually has had a positive impact, yes, on the environment, so environmental sustainability, but also facilitated the social sustainability of the workplace. So there are things you can do in terms of communication and engagement, and there's other things too. So in that book, Redesigning the Unremarkable, Deb Cushing and I talk about how you can encourage people to take the stairs in their workplace. You can put this example actually from photographs from Singapore too, of decals on elevators, and people have done things like putting little signs beside saying, you burn X amount of calories and you also save X amount of energy, and actually have done a number of promotion and information communication campaigns to change how people interact with their building in a way that has benefits for the environment. As well as the environment, so the built form, we can think about food and life waste. These photographs are from Greg Segal's 7 Days of Garbage. It's this wonderful photographic series that shows Americans surrounded by all their rubbish that they've had over a week in their lives. And I guess it helps you think about what your trash portrait might look like. Of course, in our book, Redesigning the Unremarkable, we talk about rubbish bins actually, and we have this great poem by Jacqueline Ottoman about the girls with the jars. I'm always amazed at those zero waste girls with their mason jars and their big proclamations. Here's all the trash I generated last year. Inside each jar is usually a tiny jumble of twistums from the broccoli, a few of those little plastic tabs that keep the bread bags tight, and a colourful array of produce stickers. Although I'm a bit sceptical, I do appreciate that they give a damn, and I thank them for making me think. What if at the end of every year we all had to show how much trash we created? Would we shout so loudly? How big a jar would we need? I think it's really important that we think about that, our own personal actions inside the ecosystem that we're involved with, and we can do things that build on our skills. We can have thoughtful and humorous messaging and a clean design that can change the design of rubbish bins. We can have gum recycling bins. We can actually encourage cigarette recycling through these voting bins. Okay, we can have transparent rubbish bins so people can see the rubbish we throw out. There are a lot of things that we can do differently, and that's, I guess, a challenge that's before you when you think about sustainability in the healthcare sector. From Australia at the MARTA, they have actually implemented a room service model for food, so you can actually order the food that you want rather than it getting delivered to you at certain times. And doing this, you can order any time between 6 a.m. and 7 p.m. has actually reduced the plate waste. Okay, decreased it from 30% to 17%, and at the same time it increased patient satisfaction and food costs reduced as well. And that was led by Sally McRae and colleagues. And so, there's a lot that we can do, and that's just a couple of examples about the built form, our interactions with rubbish, whether it's transport, whether it's recycling, whether it is sustainable approaches in the laundry with linen and what staff wear. There are many, many ways that we can be more sustainable in hospitals and healthcare. So I challenge you to think about that with a co-design lens, so work in partnership, and also with a creative design lens. So think about how we might introduce these ideas in a way that might be playful, as long with being sustainable. They're also creative. Good luck.